Hello, everyone. It's Dr. Cary Yurkiw here, and I want to welcome you to our webinar today on stretches for back pain. Many people have asked me when I do my webinars if I could include some stretches. And so today I thought we would focus on stretches for back pain and focus on specific conditions that um, that stretches can help with. If you have any questions, feel free to type that in the chat. I'd be happy to answer your questions towards the end of the webinar. So my name is Dr. Cary Yurkiw. I'm a chiropractor who's practiced for 26 years. I saw a chiropractor when I was young. So I had some hip pain and knee pain, and I decided that I would go see the doctor to get some help. My parents took me to the medical doctor. He assessed my pain and basically told me that I had growing pains. And my father had heard about a chiropractor in our area and took me to the chiropractor. He assessed me and he did some x-rays and he had me come back and he showed me that what my condition was. He gave me a diagnosis and he told me he was going to treat it both with hands-on adjustments as well as some electromagnetic therapy. I kind of had a tube with that current that would go through it to stimulate the healing of my knees. So that was how I started with chiropractic. It made a big difference for me because at that point I wanted to play hockey at a higher level. And so my knee pain and my hip pain they were holding me back, and the chiropractic care allowed me to move forward and to get healthier, get rid of the pain, and to play at a higher level. I opened a clinic in Winnipeg, and that was after going to school in Toronto for 3 years. And after school, I returned to Winnipeg, where I was from, and I did locums. And locum is when you take over for another chiropractor when they go on holidays or if they get injured or they get sick. So I took over for clinics and I learned a number of different techniques and practice styles from the chiropractors I worked for. And that was a great practical experience for me coming out of college. Then after 3 years, I decided to open my own clinic, and I opened it on Portage Avenue in Winnipeg, which is a high-profile location. It was close to a radio station called CJOB and FM Power 97 at the time, and that was a good location for patients to get to. The radio station would sometimes have me on talking about a variety of different conditions and news reports, and sometimes on FM they would kind of like to poke fun at me or chiropractic, but they came to my clinic as patients, and they also asked me a lot of questions as a professional. So that was good for me and the clinic. And then after a number of years in Winnipeg, our family moved to the Okanagan, and I opened a clinic in Penticton, and I was there for 10 years. Now, more recently, our families moved up to Kelowna so my children could go to university, and I started a new practice in Kelowna at the landmark buildings, which are the tall glass towers in Kelowna. We have flexible hours there. We're there often later till 7 p.m., and then weekends too. So what are the best stretches for different types of back conditions? Well, some of the best stretches are just to open the joints up, to allow more flexibility in the joints, or allow better fluid circulation in the joints. The receptors in the joints, the mechanoreceptors, they're more powerful than the pain receptors. We call those the nociceptors. So when you're stretching, it actually inhibits the pain receptors temporarily. And so stretching can make you feel better. It can reduce the amount of pain. It can increase the circulation. It can increase your flexibility, and it can maintain a lot of the changes that we're making in the clinic. So I like to prescribe stretches, not right away, but as the treatments progress, I like to recommend stretches to maintain the changes we're making in the clinic. A disclaimer, I think it's important for you, if you have back pain, to consult with a health professional about your specific condition and specific stretches for your back pain. So I'm going to give you some general stretches today, but it's best if you consult with someone who knows your back, who's assessed you properly, and can advise you as far as specific stretches for your condition. So why stretch? Well, stretching helps to maintain the gains that we're making in the clinic. It promotes elasticity or stretchability of the joints. It improves the blood flow around the joints for healing. It improves the synovial fluid circulation in the joints to lubricate the joints and to help to have easier movement in those joints. Long-term, movement is important for health. So the more moving you do, the more flexible you are, the better that is for your health in general long-term. So there's few drawbacks, but I do think you have to respect your body and you have to respect what it's telling you. So if you're feeling a stretching and a pulling and it kind of feels like a good stretch, that's a good sign for you and your back. But if you're feeling like sharp pain and there's a limit, I would respect that as well and back off. So you listen to your body when you're doing the stretches and then report back to your health professional and let them know how the stretches are going. More recently, I've been using telehealth in the clinic to follow up with my patients and to see how they're doing with their stretches. So I find telehealth has been a really positive benefit to my practice, and I enjoy using it and would be happy to use that with you if you're a patient of mine, or if you live in British Columbia, I'd be happy to do an initial assessment using telehealth with you. I like to prescribe stretches for specific conditions. So some of the conditions that I see are arthritis, which is a wear and tear, a degeneration or breakdown of the joints. Facets, which are where the two bones meet, that's called the facet. The facets get irritated and that can cause pain. A nerve entrapment like sciatica, where a nerve on one side, on the right side or the left side of the spine gets pinched. For discs that are getting compressed or bulging, for muscular tension around the spine, and for ligaments and tendons that have been sprained or strained. So these are some of the conditions that I like to prescribe stretches for. I did write about different back conditions in the book that I published on back pain, and that was last year. So it took a while to write this book, but I completed it, and it is on Amazon, and you can get it in Kindle format, paperback, or Audible, an audiobook. But in that book, I wrote about a number of different conditions and the approach I take for those conditions. One of the things I'm thinking about is adding stretches to the book. I don't have stretches in the book right now, but for the second edition, it is something I'm considering and would like to add stretches and some chapters to the book. So I'll keep you posted on that. And if you want to be on our mailing list, I'd be happy to keep you updated on future seminars like this and future developments. I think to understand stretching, you have to understand the anatomy and physiology in the body. So there's 24 vertebrae in the spine from top to bottom. There's discs in between the bones. They're like shock absorbers. They allow you to bend and twist and sometimes sit and compress the discs. So the discs are like shock absorbers in there, but they allow the height or the volume between the bones, which allows the nerve roots to come out on either side of the spine. So they're important. There's joints and cartilage on every bone. So basically, the cartilage protects the surface of the bone, and then in between the bones, there's synovial fluid in the joint, which is like a lubricant. Having the joints and the discs and that synovial fluid allow you to move, bend, and twist. But the spine also protects the spinal cord. So it protects the cord running through from injury. It allows the signals to get through from the brain to the body and from the body back to the brain. So protecting the spinal cord is one of the major functions of the spine. If the spinal cord or the nerve roots are affected, if they're getting pinched or if there's interference, then the body will go into a protective mode where the muscles will get tight, the area will start to lock up, and that's to protect the nerve flow. So it's important to understand that sometimes muscle tension is a result of a protective mechanism in the body that could be caused by injury or a nerve that's being affected in that location. The general movements for stretches are flexion, extension, and extension going backwards can be difficult because the nerves tend to exit on the back part, the posterior part of the spine. And so if there is some nerve interference there or irritation, going back into extension seems to irritate that more than the other movements. So I often give stretches to my patients in extension as one of the latter stretches that I give them. So I try to hold off giving any extension types of stretches, but today you'll see in one of the yoga poses that there is an extension stretch in there. Twisting is another movement, another direction that you can stretch in, and then side bending, going side to side. The first stretch I wanted to go over with you is forward flexion. So this person is bent forward. Some of you won't be able to touch your toes like this, so go as far as you can. Hold that stretch for 2 to 5 seconds, and then release. Come back up into a neutral position or a seated position, and then do that again, holding it for 2 to 5 seconds, and then release. And do that 5 times. So it's good to do it repetitively, reinforce the flexibility of the spine, and start off with 1 or 2, and then build yourself up into that range of 4 to 6 times. This is good for arthritis, so it's good for joints that are degenerating. I call it rusty, joints that are getting rusty in the spine. It helps to get the fluid and the circulation going in the joints, and it helps to increase the movement of those joints. But sometimes it's not good for discs or conditions like sciatica, and the reason is forward flexion sometimes squishes the discs and causes them to bulge a bit more in a certain direction. And it's not good for sciatica because the sciatic nerve comes out of the lower part of the spine and it goes down like a string all the way down to your toes. So what can happen is you can pull on that sciatic nerve in forward flexion, and that can irritate it. Stretch number 2 is rotation. So this person is sitting, they have their knee crossed over, and they're rotating in the opposite direction. So do this gently, hold this for 2 to 5 seconds, and then release, and do this 4 to 6 times. Again, this is good for arthritis. It can be good for the facets too. So if you have a facet syndrome where the bones come together, it can be good to improve the movement and the circulation of the facets, but it can affect the disc again. So rotation is hard on the disc, and compressing and rotating the disc cannot be good. So if you have a disc issue or injury, this is not one of the stretches I would give a patient with a disc. So again, consult with your doctor who knows your condition better. Stretch number 3 is side bending. So hold this for 2 to 3 seconds, then release. Do this 6 to 8 times. This is good for your joints. It's good for the nerve on the opposite side because it opens up the canal between the bones. We call it the foramen. So it opens up the foramen and allows better nerve flow to get through. It can be bad for the nerve on the same side. So if you have a pinched nerve on the right side of your spine and you're doing this stretch, like this gentleman to the right, it can cause further compression. So it can actually affect you and increase the pain. So for some of my patients, what I'll do is just recommend doing the stretch to one side, but not the other. And that's because I know their condition well. Stretch number 4. This is a yoga stretch and it's called the CatCow. Hold this position for 2 to 3 seconds with the back arched forward, then release, and then go backwards for 2 to 3 seconds into extension. So this can be good for flexing and extending the joints. It can open the joints up and promote circulation on a core level. I would do this 4 to 6 times back and forth. And again, you can just start with one stretch and then build yourself up to 2 and 3 as you feel more comfortable. This is good for arthritis. It is good for the discs to get the discs a little bit more flexible to promote circulation in the joints. Sometimes it can irritate the facets, and that's when you go into that extension position, which is the one on the far left. And stretch number 5, this is bringing your knees up to your chest, holding for 2 to 3 seconds, and then releasing, and doing this for 4 to 6 times. This is a nice, easy stretch to do. I find a lot of people enjoy doing this stretch, and it's good for the disc, and it is good for arthritis. Sometimes it can be bad for sciatica because, again, that nerve comes out of the lower part of your spine. It travels all the way down your legs to the tips of your toes. And so if it gets stretched, it can get more painful. If you have joint pain and you live in the Kelowna area, please call our office. It's 250-486-0062. We are taking new patients. We'd be happy to assess you, provide treatment, and then some stretches so that you can maintain those changes that we're making in the clinic yourself. You can also sign up for our free webinars that are coming up. So we have a book reading tomorrow on back pain, the book that I showed you today. We have a webinar coming up on joint pain and arthritis. That's next week. And then the week after, we have lifestyle changes for back pain. So we're covering all the major areas that we advise patients on to help support the changes they need to make at home and support the care in the clinic. So feel free to sign up for those. You can go to Eventbrite and follow us. And that's where you got your ticket today. We'll also send you an email follow-up and just let you know when the upcoming webinars are, and then you can click on a link and easily sign up for that. If you don't want to be on the email list, just click on this unsubscribe button and it'll take you off that email list. So I want to thank you for joining us today, and I hope you learned something about stretching. I hope you get some relief for your back pain. Definitely take action and see a health professional about your back pain, and then do some supporting lifestyle changes that can really help you to have a good outcome in the future. So have a wonderful day, and thank you for joining us today.